So before I hand over to today's speakers, Hannah and Sophie, and while you're all still tuning in, I just wanted to say hello and introduce exactly what Customer Centricity Month is. And to those of you who've tuned in for the last 2 sessions, I'm sorry that you're going to be hearing this for the 3rd time. So I'm Lauren, I lead the marketing and events team at CX Partners. And at CX Partners, we work with organisations to drive growth, unlock opportunities, and enable teams to work together more effectively. We do this through detailed research programmes, through user-centred design, and through embedding a culture of customer centricity within organisations. So earlier this year, we launched our Customer Centricity Model, which was the culmination of a study and detailed research piece with over 100 European brands into what builds a highly resilient and successful organisation. Off the back of that, we developed our Customer Centricity Model and the 5 dimensions that it consists of. And they were created so that organisations could easily assess the areas of their business where there was opportunity for improvement. And if you haven't already, I really recommend that you take our self-assessment, which will give you your own customer centricity score and recommendations for how you can improve. And we'll share that in the chat now. So far, we have heard about our process dimension and our governance dimension. And if you've missed either of those sessions, we'll also share the links in the chat to those so you can catch up another time. Today's session will cover the facilities dimension from our study, focusing on employee experience. So as I said, this is the 3rd webinar of the month, and we'll be running one more session next Wednesday, which will cover our last dimensions, people and communications. And if you haven't already, make sure that one's in your diary. So I'm going to hand over to today's speakers now. Hannah is a member of the CX Partners team, and she's going to lead today's session, and then she'll hand over to our brilliant guest speaker, Sophie Dennis, who's the Director of Human-Centred Design and Customer Experience at the UK Health Security Agency. There will be time at the end for questions, but please add them to the Q&A or the chat throughout the webinar, and then when we get to the end, we'll run through as many as possible. So Hannah, I'm going to hand over to you now.
Cool, brilliant. Thanks, Lauren. As Lauren said, we're talking here about employee experience, but just a bit about me. I'm a UX consultant, and I guess for the last 1.5 years or so, I've been working in the employee experience space. So I'm going to talk a little bit today about, I guess, what I've sort of seen in terms of what a bad employee experience kind of looks like, and see if it kind of resonates with you guys, and kind of why should we be looking at employee experience, and potentially some ideas for how we can start to kind of improve employee experience. So yeah, I'll talk a little bit at the beginning about the sort of 5 dimensions of customer centricity, and then I'll move on to about 20 minutes where I'm going to sort of talk about employee experience, and then Sophie's going to talk a bit about employee experience in the public sector, and then at the end we'll have a bit of time for questions. So kind of starting with the 5 dimensions, and this is a model that we use at CX Partners to assess a company's customer kind of centricity. And as Lauren already said, we've already had kind of webinars on process and governance, and they're available if you want to go find them and have a look. But today we're going to be talking about the sort of facilities dimension, which is kind of the tools that you use to do your job, and also potentially the barriers that are kind of put in place that sort of prevent you from doing your job. So yeah, employee experience, or kind of why we all hate doing expenses. So I've written a bit of a definition on what employee experience is. So it's the service you provide as an employer to your employees that enables them to be productive and happy. So it's essentially, it's kind of almost like a product or service in the same way you would provide to your customer or end user. And it extends from, I guess, someone kind of being recruited and onboarding the company all the way to them exiting the company. And there are lots of different touch points. So one could be systems, so expenses systems, holiday systems, desk booking systems. These are all touch points, I guess, between you and your users. Services such as HR, finance, IT. And then we've got people. So for example, your line management, or a HR representative, or an IT service center representative. And these are all kind of touch points across that journey. And the service could be quite impersonal. So, I want to order a mouse, or it could be very personal. So maybe you're discussing sickness absence or maternity leave. And very large companies, I guess, have a massive range of employees that all have quite different sort of experiences and needs. So if you consider someone like Royal Mail, they will have everyone from sort of postmen and women all the way up to sort of people working in office, and then CEOs and things like that. But they all sort of deserve the same kind of level of experience, the same quality of experience, no matter where they're working in the company. And we've seen kind of with a few companies we've worked with recently, they often define a customer experience, like what they want the customer experience to be, and have people responsible for it, but rarely define an employee experience or kind of who is responsible for it. And it's worth sort of mentioning, I think, that work is now completely different for 4 out of every 10 employees post-pandemic. So we've now seen a shift in the way people work and where they work, so over to sort of hybrid or remote working. So, you know, people are more often working from home, they're not commuting, and they're kind of prioritizing a bit more quality of life, time with family, things like that. There's also sort of a shift towards shorter working weeks, either people going part-time or companies offering shorter working weeks as a way to kind of encourage more people to come and work for them. But the flip side of this, I guess, is reduced social contact with your kind of employers. I mean, I was talking to someone yesterday about like what we work with lots of different companies, and some companies we work with never turn their cameras on. And I can imagine working somewhere where you literally never see the faces of the people that you work with must be quite difficult. And then we've got a whole generation of people, I guess, coming into the workforce, Generation Z, who will kind of always work like this. They will never kind of have that kind of social contact. So it's something that we have to adapt to and think about rather than kind of, I guess, resist. And there's going to be positives and negatives to this way of working. So what leads to a poor employee experience? And again, these are kind of my observations from kind of working with a few different companies. But the first one is kind of disconnected employee experience teams. So you might have multiple teams that are kind of work in the employee experience space. So I mentioned a few before, they're like HR or IT, but they very rarely seem to kind of talk to each other about what's the experience we're providing and how should we kind of make it consistent. I mean, at the moment, I'm looking at kind of an onboarding experience, and as you can imagine, that touches on multiple teams. So, you know, going from HR to IT to potentially even security and people like that. But all of those teams work almost completely in silos, and the only person overseeing it all is the manager. So it'd be quite difficult for these teams to kind of, you know, have a kind of consistent experience. And there's also, you know, a lot of overlap. Like we've seen where people kind of get confused about who owns this thing that I want to do. So for example, expenses, does that sit with travel? Does that sit with finance? Does that sit with HR? So, you know, when you've got, it's not really clear like who's owning what from the customer point of view. And the next one is poor internal tech. And this is kind of why I labeled my presentation, why we all hate doing expenses. I think we've all probably experienced the frustration of hitting a brick wall with the tech that you have to use to do your job. Often there's like a quite high level of investment in kind of customer facing tech, but less of an investment in kind of the employee facing tech. But it can often be, you know, we've seen it where it can be really difficult to use, really slow. So like really ancient tech that just takes ages to load. It could be inappropriate for the job it's supposed to be doing. So potentially, you know, you've got something that 10 years ago was great, but now doesn't really do the things you need it to do, or you know, the wrong software's in the place to do a certain job. It's non-existent, so you know there's no software actually in place to do it, so everyone's still using pieces of paper or kind of guessing at what's going on. And the other side of this is kind of security. I don't want to kind of name names, but security and kind of data protection have quite a big stranglehold, I think, over what tech gets used and who gets to use it. And they're quite far removed, I think, from the decisions from the people who are actually using the tech. And you know, the same with the sort of decision makers about who is actually, you know, what tech is being used and where is it being used, are quite far removed from the actual end user who has to use them. So we often see like barriers put in place where we're told, oh, we're not allowed to use that, you know, we're not allowed to use that piece of cloud software because we've been told no cloud software. But in order to collaborate, that's kind of what most people are now using. The next one is kind of assumptions made about user needs or experience. And I kind of touched on this before, like not really understanding what employees need to do their job. There's often assumptions, you know, it's quite easy to sit in an office and say everyone's going to like me. Everyone has access to a computer, everyone has access to Wi-Fi, but that might not always be the case. So you might ultimately end up excluding people because you haven't really understood that actually they actually work in the field. They don't have a laptop, they only have a phone, and they're very rarely connected to Wi-Fi. So you know, there's sort of big assumptions being made that might lead to exclusion. On the other side, you might actually assume that your employees are much more kind of like smart than they are. I don't mean that in a bad way. I mean, you know, you're sort of thinking they're, you know, they're very smart people. We shouldn't be talking down to them. We should be making things kind of not complicated, but making sure that it sounds like we know they're smart. But it's kind of that thing. If you put I was going into Boots earlier, and if you've got like an automatic door and if you've got a regular door, it doesn't matter how strong you are, you're going to go through the automatic door. You don't need to prove anything by going through the regular door. So if you're going to put experiences in place and they're super easy, everyone will just use the easy thing because no one wants to make their life harder. So, you know, on that side as well, understanding that everybody, you know, wants something that's accessible, no matter who they are. The next one is poor measurement of employee experience. And I have to say, measuring a user experience is always really tricky. It's one of those things that people really sort of struggle with. But in order to sort of understand whether anything you've done has made an impact, first you need to sort of benchmark and understand what's going on right now. So, you know, if you're going to make a change to, say, a page on your intranet that explains sickness absence, you need to first understand, say, you know, how many people are currently calling the call centre to ask about sickness absence, or how many inquiries do we get, and, you know, how quickly are they resolved, in order to understand, yeah, we've now put something in place to make that change. So it's kind of trying to create some loops of kind of benchmarking and then kind of re-understanding whether you've actually made that change. The last one is sort of poor or sort of no feedback loops. To be fair, a lot of companies do use things like the Great Place to Work survey, so that they could kind of gather kind of feedback on what's going on. But what really needs to happen, I guess, is that actually you start to kind of then go back to people and say, well, this is what we've done and this is what we're doing based on the feedback you've given us. And the idea here is that you kind of bringing people along the journey. They can often be that there's a lot of change really quickly, or, you know, changes are made without really kind of consulting, I guess, the end user. But what you want is to sort of say, come on with us along this journey. We want to kind of make sure you're involved and that you know what's going on, and that change doesn't happen at a rate that you can't keep up with. So what's the impact, I guess, of poor employee experience? What could happen, I guess, in your company if the employee experience is bad? I guess the central part of this is employees being blocked from doing their job. So you can imagine coming into a company being told, right, you're a user researcher, go forth and do some user research, and then you sort of say, okay, right, let's set up a session, and like, oh, actually we don't, you have to put in a purchase order to ask for money for this, and then, oh, I'm not sure if we can't use that software because that software is not allowed. And, you know, you can sort of start to see, you've brought me in to do a job, and then the frustrations start to kind of mount because you don't have the tools, or, you know, and there's a lot of barriers in place that are blocking you from doing your job. And what this can lead to, I guess, is kind of time being wasted. Recently, we were sort of studying sort of various tasks across, you know, a number of systems. And one of the simplest ones we asked people to do so we could understand how quickly they could do it, which was downloading a payslip. So, and on average, it took people around 7 minutes to download their payslip from beginning to end, which is a really, really long time. If you ever sort of sat still for 7 minutes, it feels like an eternity. Which kind of, we then sort of extrapolated that, calculated it. It was roughly 907,200 hours per year that this company was spending, people in that company were spending downloading payslips. And it's a very small task. And obviously it's not going to be zero, but it shouldn't be that many hours. And think about all the things that your employees could be doing in that time, when they're actually spending all this time kind of with all these barriers in place to just do a really simple task. It's worth saying, I guess, that when it comes to these sort of tasks, managers are much more adversely affected. If you've got someone who's a manager, they could probably spend around half their week just doing these kind of admin tasks, you know, like performance management, approving POs, approving annual leave. And if the systems and stuff in place are really poor, then that's just going to be extrapolated for managers. This then leads to disengagement. So reduced productivity, reduced energy levels, reduced morale, and this kind of spreads like wildfire across the team as well. If you've got disengagement, it can often lead to disengagement with people around them, which is kind of inevitable if you're not really allowed to do your job. Why, you know, you've tried, you've sort of said, I want to do this, and every time you try to do that, you know it's going to take you, you know, a whole day when it should be taking you an hour. So you're just like, oh, I just won't do it. I'm just not going to bother. The next thing it might lead to is exclusion. The tools and things that you might be, and processes that you might be putting in place might not be accessible to everyone in your company. So, you know, if you've got people in your business with like low digital literacy, they've got access to different devices. So they, like I said, they've only got access to a phone, or they've only got access to a tablet. They might not have access to Wi-Fi. They might even have accessibility issues. So they might only be able to view something with a screen reader, or they can't use a mouse or a keyboard. This means that, you know, if you have certain things where you've designed it to be kind of used in an office, you're going to start excluding people, and people are going to start to feel they're not part of the company anymore when you kind of, if you have things like that in place that can't be accessible by everybody. This in turn will potentially lead to higher turnover, so people will start to leave. It costs around £6,000 on average to fill a vacancy in the UK, but this can rise up to about £19,000 for a manager role. And then this then leads to knock-on effects of poor reviews on sites like Glassdoor or LinkedIn. And the final thing this ultimately leads to is a poor customer experience. So the external facing customers, the people that you're actually trying to sell something to, if people are limited in delivering on the product or service that's, you know, that kind of you want to sell, then, you know, they're going to not really be able to put any effort into that customer experience. If they're spending huge amounts of time doing kind of banal admin tasks, or that you've put barriers in place to stop them actually doing their job well, ultimately the customer, your end customer, is the one who's going to suffer. And we had an example of this. We spoke to Octopus Energy, and they were telling us about how their call center employees are kind of empowered to do, you know, what they need to do to solve a problem. And there was a woman who rang up who her car had broken down, so she couldn't get back in time to meet the boiler man. And the customer experience person was able to get them a taxi, rather than passing them around or being like, oh, I don't have money, you know, I don't have approval to kind of do this. They were empowered to do it. They were kind of unblocked from it, and they were able to give that person a really good customer experience because they were able to do that, basically. So how can we start to think about improving the employee experience? So I'm a UXer, so I think everything should be approached like UX, but essentially what you should be doing is thinking about putting your customers or your employees at the heart of everything you do. So this kind of means, I guess, you've got probably got various teams who are already responsible for that service. So are they really kind of thinking about what their customer kind of needs are? Are they thinking about how they could best, you know, meet those needs? And I guess, you know, this kind of leads on to the second one, which is maybe think about creating an internal employee experience team. So a team that basically has overarching responsibility for the user experience across the whole, you know, across the whole piece. And as I kind of mentioned before, there are kind of journeys in there that, you know, are kind of completely siloed at the moment. But if you can open those up and kind of break down the barriers between all the teams that are kind of delivering this service, and then you can sort of start to sort of define what the goals might be of that service, and what do you want it to be? What do you want the employee experience to be, and how does that work? And the other thing an internal employee experience team can do is really understand the employee needs. So like I said, you know, do they work in remote locations? Are they on their feet all day? And so therefore, you know, they don't really want to be dealing with other stuff when they get back. It's just kind of creating that real deep empathy and understanding with what the employees need. The next one is kind of an easy one, but also a tricky one: invest in internal tech. So again, this is one where obviously you need a bit of money to do this, but I mean, considering the number of hours that were wasted on just downloading a payslip, if you extrapolate that, that was one of about 20 tasks we were looking at. And think about how much money actually has been kind of wasted. You know, nothing ever, you know, you've got these systems in place. When people think about system maintenance, they think it's staying the same, and actually when you bring something in, it can get worse and worse. You know, there's no such thing in some ways of like just everything staying the same. Things do get worse and degrade over time. So investing in internal tech is really important. Quite often we get brought in once a company has bought a piece of tech and they're surprised their employees are not using it how they think they should be using it, or yeah, it's just not working the way they thought. So we get brought in and they sort of say, can you make our employees use it how we want them to use it? And then we kind of there sort of stuck sticking a kind of square peg into a round hole. Whereas really what you should be doing is considering the user needs. Like, what do they really need from this tech, and how can we give that to them before you go out and buy anything? And you need to sort of be then working with, you know, security people, data management people, so that you make sure you're getting the best piece of tech, and that the people who are making those decisions really understand what those people need from that tech, rather than making these sort of blanket decisions about the tech across the whole piece, or buying tech that maybe is just not really appropriate for the kind of world we're working in today. Don't forget, you know, this tech kind of does reflect you as a business. It's kind of, it's in many ways, it's like this, your screen now is your business. That, like, what I look at every day is the company I work for. So it's, if it looks rubbish, it's going to feel like people think, well, they don't really care about me, they're just showing me this rubbish that I hate using. So yeah, it really does reflect who you are as a company. And the next one is kind of in trust and empower, and I think I've sort of touched on this a little bit, but kind of trusting users, working with security to potentially unblock some of these things, but kind of putting a little bit more trust back in the employees to sort of define what they want to use and how they want to use it. And then the last one is kind of measuring, creating feedback loops. And I guess I sort of touched on this before. This can be quite tricky, but what we've kind of started doing is at the beginning of a project, kind of looking at what can we measure and how can we measure it, rather than often relying on what's already there. We try to push forward and say, okay, what could we be measuring now? So we've done some stuff where we sent out a survey, and we kind of benchmarked kind of satisfaction with all the systems at the moment, and sort of said, how do you feel about them? And 24% of people were satisfied with them, which was bad, but from our point of view, it's good, because we can then make a positive change. And then we tried to repeat that kind of fairly crude, I guess, metric as we're going along. So every time we kind of create something new, we sort of sit down with users and say, right, how satisfied are you with this now you've seen it again? And then the last piece that we did, we managed to sort of, we asked, you know, how satisfied are you with this kind of navigation we've created? And we got them to sort of 90%. So 90% satisfaction. So if you've gone from 24 to 90, you know you're roughly going in the right direction. And you could kind of, then you can report that back and tell people, like, we are doing the right job. And also people are kind of engaged with us, and they're, you know, they're telling us what they think about this thing that we're creating. Why do this? Why even bother? So it's not a big leap to say that happy employees equals happy customers, which equals happy businesses. So if your employees have the tech, you know, to do their job, if they're unblocked from doing their job because the processes are smooth and easy to use, if they know how to access information and services, and those services feel easy, you know, if you're sort of sitting down to do your expenses and you're not sort of like, oh God, I don't want to do this, but actually you kind of go, okay, this is quite quick, easy, done it in 2 minutes. Then, you know, you're taking away that stress, you're taking away that cognitive load from someone to just get out of the way and do their job. And this will just allow them to focus on delivering a great product, on delivering a great service, and most importantly, be able to focus on delivering a great experience for your customers. On that note, I think I'm going to hand over to Sophie, who's going to talk about human-centered design in the NHS.
Thanks, Hannah. Hi, Hannah. Hi, everybody. Lovely to see you. I'm Sophie. I'm a design director. I specialise in building high-performing user-centered design teams, mainly working in the public sector, and for the last 5 years in NHS and public health, including I spent the last 2 years scaling human-centered design at what at the time, just over 2 years ago, was NHS Test and Trace, from 0 to 120 people in just 18 months. I stepped back from that role in the summer. I'm still doing some consulting for them, and I'll talk a bit more about that as we go along. So I wanted to talk about, probably cover just 3 things today, quite quickly, in 20 minutes or a bit less, if possible. I want to talk a bit about whether customer centricity is relevant to the public sector, because I think that's quite a big question that a lot of people in the public sector have. And then just build on what Hannah said and talk a bit about why employee experience matters to the end user experience in public services, and also what you can do about it, in particular as a design or a product or a CX leader, both looking in 2 ways really, one for your own team and the other thinking about kind of customer facing staff. So like I said, customer centricity in the public sector, I think the word customer can be a really problematic word to use in the public sector and apply to people who use public services. And a lot of people working in the public sector still find this really uncomfortable as a term to use. And it can be quite jarring and feel like what we're trying to do is privatise public services, essentially, I think is one thing that it triggers in quite a lot of people. One thing that was really interesting in going to work for NHS Test and Trace is, at its best, it really did bring together the best of the private and the public sector. I think the people who came in from the private sector learned an awful lot from those of us who'd been in the public sector for a long time, particularly around the agile user-centered design frameworks from GDS. And similarly, we picked up things as the sort of public sector steeped people from people who came from the private sector. And one thing I think they really brought in, which was really interesting, was this concept of a customer function, of a chief customer officer who sits right at board level, reporting directly to the chief executive, as that really powerful voice of the customer, and a function that integrates not just those sort of user-centered design and product, but also brings together marketing, comms, innovation, insights, and so on into a coherent customer function. And one really great thing that our chief customer officer did was to talk about how to reframe thinking about customer for the public sector. And this framing that she offered us, which I found really powerful, was this idea that our customers are the people we are here to serve. And I think if we apply that to the customer, to the public sector, then you can immediately start to see how concepts like customer centricity can be really, really powerful. And I think it's also worth sort of going back out, because when we think about who are the people we're here to serve, I think it really connects us really powerfully back to organizational purpose. So even if you're in the private sector, so your customers aren't just necessarily whoever's going to pay you most money, but that thinking about what as an organization are we actually deeply here to do, for whom and how. And at that point, I tend to then look at thinking about being customer centric as the culture and practice of maximizing the value created for the people we're here to serve over other organizational priorities, which might be reputation, cost reduction, short-term delivery deadlines, and so on. And a bit like it says in the Agile Manifesto, it's not that we don't care about those things like reputation and costs or profit or hitting the deadlines that we've promised to ministers, but that in a customer-centric organization, there's an understanding at all levels that those goals and objectives are best served by thinking about how we maximize the value for customers, or the people that we're here to serve. Which I think does lead to this question that Hannah touched on of, so why would we invest in employee experience? If we want to be customer centric, shouldn't we prioritize investment in things that directly impact on customers? And I think this comes from a couple of things that I want to talk about. Firstly, I think this issue of employee experience and whether people just have the basic tools to do their job, it really does impact on all those other dimensions of the customer centricity model. So it impacts on process and governance. Do people have the tools and the systems that support light touch governance without getting in the way of people doing their work? Do people have the tools they need for communication? Can you attract and retain the right talent because you're giving people the tools that they need to do the job? So it really does impact on all of that. But I thought it was worth today diving probably a bit deeper into two aspects, which are really focused about what can you do as a design product or CX leader to have most impact on that sort of employee experience. And I think there's two areas that you'd want to focus on. One is improving the user experience of internal tools and systems that are used by your effectively frontline customer facing staff. It's that really classic, the front to back of service design of where are the things in the behind the scenes that are preventing us from creating a really great experience for end users. And the second area, I think, is reducing friction for your own design and user research team through practices like design and research ops. So thinking about the internal tools and systems used by frontline customer-facing staff, I think this is something we see really, really clearly across the public sector, but it's very, very sharply brought into focus when you work in healthcare and the NHS. The user experience of the sort of software systems that are used by clinicians and support staff in healthcare is really just as important as patient experience as those patient-facing digital tools. It's kind of the easy bit, and I put easy in those kind of square quotes, because it really isn't that easy, and it really is quite hard work to do, is to put that kind of consistent front-end veneer on the user journey, especially the digital user journey. That makes things look and feel kind of joined up, even when they aren't really very joined up under the hood, but it removes some of that otherwise quite jarring, disconnected experience that people can have as they move through different bits of their journey, and perhaps, you know, underneath it, different software systems that they're needing to interact with. And it can be really, really effective, but there are definitely hard limits to how far you can paper over the cracks in that way with those sort of front-end digital tools. And eventually you hit the places where those back-end systems just not joining up really prevents us offering patients the experience that we know they need. And as an example, for example, we saw this in discovery work that I led on supporting healthcare appointment bookings and referrals through better digital technology. And what we saw there was that a huge amount of the pain involved in getting an appointment, this was not so much with GPs, but getting hospital appointments. So when you've been to a GP and they need to refer you on to a consultant. And people have really, really weird experiences with this, where they get an appointment letter, and then they get a second letter that says the first appointment has been cancelled, and here's a new appointment, and all these sorts of things that make this quite a strange, distarring and disconcerting patient experience. And a huge amount of them are actually caused by the system that was being used to manage referrals, the limitations of the software that staff are using to managing them, and all the workarounds that they were deploying essentially to get the software to match how the service actually worked. And as well as that sort of really direct impact on the patient experience, the staff experience, particularly with these tools, really affects patients in two other ways that perhaps are at times a little less obvious and direct, and that's staff productivity and also, really importantly, clinical quality and safety. Staff productivity is a really big one. Amazingly, there were some statistics yesterday that showed that we actually have more staff in the NHS today than we did a few years ago, despite everything that we hear and everyone talked about it being chronically understaffed. So it's not just that we don't have enough doctors and nurses and support staff, it's also that they don't have the infrastructure needed to do their jobs efficiently and effectively. We have a chronic underinvestment in IT and digital in the NHS. The NHS England estimate we spend less than 2% of budgets on technology compared with the recommended 5%. And this goes from everything from basic equipment through to the quality of the custom software that people use. Often the basics just aren't there. Staff frequently have to log into multiple systems in order to get their work done. Computers are often old and slow. It can take a very long time even just to get access to the tools you need. Staff sometimes talk about it taking half an hour to log in the mornings. Often basic kit like keyboards doesn't work, and so on. And in some departments, small changes like that can have a massive leveraging effect. So when I led a review of user experience of digital in urgent and emergency care, at the time there was something like 5 million A&E attendances across 180 A&E departments in the UK. And one of the senior clinicians had estimated that if it took an extra minute for each of those visits for a doctor or a nurse to enter patient information into the electronic patient record, that added up to a total of 200 doctor shifts a year that you were either taking extra for that extra minute that it would take to enter things, or that you could save. And there was a big variation. Some systems it took about 3.5, 4 minutes to enter patient information. At the other end of the scale, it could take 12 minutes for someone to enter it. Now 12 minutes doesn't sound like very much time, and in a lot of specialties in healthcare that wouldn't be a significant impact, but somewhere like A&E, where you're seeing literally hundreds of patients a day and that turnover and flow is really important, it can have a massive impact. And finally, as I said, the impact on clinical quality and safety can be a really serious issue that can be quite hidden. But the quality of clinical decision making really depends on clinicians being able to really quickly access and absorb large quantities of information. When you talk to patients working in digital health, they'll often talk about how they want to be able to see all their information all in one place. And that's very much a sort of patient experience aspect. But clinicians and doctors also need to be able to see key patient information all in one place. Often that logging into multiple systems is about the fact that the patient record is held in multiple locations, and you have to log into each of them separately for security reasons. But sadly, when doctors can't get that information, all the systems they're using aren't usable. There can be often quite tragic incidents where patient safety is quite seriously compromised through poor usability. And I'm sure similar issues exist in other industries as well, where the systems that staff use can have quite critical safety issues as well. Fundamentally, though, that's about giving the staff who work on the front line the tools they need to do their job and the tools they need to serve patients and communities really effectively. But that can be a really big area to sort of try and tackle. So the other thing I wanted to just bring that a bit closer to home is this, to talk about what you can do as a design leader working with your own team, because in the end, to have an impact on these experiences of the systems that staff are using, as Hannah said, what we need to be doing is bringing all that really great user-centered design methodology to bear on improving the tools that staff are using. So an area that we worked on really hard within Test and Trace in setting up the human-centered design team was reducing friction through the design and research team, through setting up a really good design and research ops operation. One of the first people we brought into the team was to hire a research ops lead, as well as a talent manager, the brilliant Sarah Carter, who was the first member of what became a wider design ops team. And that was partly because I knew that we needed to scale. I knew we were going to need to, we went from about 0 people in the core in-house team, and we were working with quite a few people through our partners, but no one really in September 2020. On the 1st of October, we had 40 people arrive out of the blue, and we doubled that within about 6 months. Then, as I say, went up to about 120 towards the end. And we were based within the Department of Health and Social Care, and while there was quite a mature user-centered design operation within partners like NHS Digital, the department itself didn't have any user research capability in particular. It didn't have any, it had some design capability, but that was mostly sort of graphic design for communications. So there was literally none of the infrastructure you needed to do user research. We couldn't recruit participants, we couldn't pay them incentives, we didn't have data sharing agreements in place. And as anyone who's had to do that kind of work in user research will know, that's, you know, quite a lot of work to set that kind of stuff up. And of course, even though we were in a pandemic and lots of the, a lot of work was done to get the bureaucracy moving faster, we were still fundamentally working within a large government bureaucracy. And I thought, well, that might just be worth reflecting on, because I think even in that kind of environment, what we found is you can have quite a big impact on your team's user experience, even when your hands are quite tied still by, like Hannah touched on, IT says no, HR says no, these are the rules, this is the process, have you gone through your 15 finance approvals? But it did, I think, massively help to have a dedicated team of people whose job was to cut through that processes and procurement and finance and everything that sat around it. Really echoing, I think, Hannah's point there about those quite disconnected teams often between IT and HR and finance and commercial and so on. And what your design and research ops team can then do is give you a sort of integrated layer over that that smooths out all of that disconnect for your team, and just joins it all up. And I asked people who'd worked on my team for some sort of feedback on that. And I was actually really pleased to have, you know, many of them came back saying it just made such a massive difference to their ability to do their job, that they just didn't have to worry about all that noise and nonsense of things from, you know, getting access tomorrow to adding their user research to the structured URL response repository, and just having an overall really good onboarding experience, whether they were a team member or a design leader. That research ops team did make a massive difference. So I would definitely invest in research ops. I mean, I've highlighted research ops. I think that's where we started, and I think that was the right place to start, because research ops, user research often literally just cannot happen if you don't have some basics in place, like participant recruitment, if you don't have survey software and things like that. And also, we can't do user-centered design without user research. That's absolutely a must-have. But design ops, I think, needed to follow fairly quickly. And we started, as I say, focusing on talent management because we had to scale quite quickly. But also covered things like, you know, just getting people Figma licenses and so on and so forth. And it's been quite interesting reflecting with, just this week, actually, I was talking to the person who's still trying to keep that running, who doesn't have a user-centered design background. And she was saying, although she's really good at navigating the civil service processes, there is that specialist knowledge that she really feels the lack of. So I think that we had a lot of debates over the summer when resizing the team about, was it a specialist role, or could someone with that, you know, generic admin skills do it? And I think that really has emphasized that there are specialist knowledge, certainly, that you need to bring to being an effective research or design ops function. I think in terms of doing it in a large, I mean, from my context is government bureaucracy, but I think any large organization has a lot of the same aspects. I would definitely focus on what's doable, not what's perfect. There will just be things you can't change. And you can waste a lot of time and energy and not make a difference if you insist on a perfect state, rather than saying, okay, so for example, we didn't have Slack, we had Teams. We could have spent a lot of time trying to get Slack, or we could get on with making Teams work better for people and helping people to use that more effectively. And I think related to that is this starting early. Like, everything takes longer than it should. It took us something like 6 months to get our initial master data protection impact assessment in place to be doing research. So the earlier you start, the sooner you actually have those things in place. So even though things look tight, sort of, it definitely goes with that, do what's doable. Just because something takes a long time doesn't mean it's not doable, but you do need to get started and make a difference to it. And finally, I think there is a lot you can do for the broader experience of your team, even when you can't necessarily give them all the IT and software and tools they want, because, you know, bureaucracy says no. And I think that is giving your team the time, space, and permission to do their work. One of the most powerful things about having that chief customer officer and design director reporting directly into them is it doesn't clear away all the top cover issues that design teams always have when telling powerful, important people that they're wrong. But it does give them just that underlying confidence that they're not going to lose their job or otherwise find themselves quietly punished for basically doing their job, which they say so often to have to come back to people and say, you know, that thing you thought was a good idea, it's not really going to work. No, users don't think like that. That's not how people use the tool. So I think that is ultimately, as well as giving people the tools and the permission, is part of it. And giving people the tools they need to do the job is part of signaling that you trust them and you're not going to quibble when they say, I need this piece of survey software, I need this piece of design software, that you do trust them to do their job and to be professionals. That is my 15-20 minute canter through employee experience in the public sector. Hannah, I think we have potentially opening up for questions. Lauren?
That's right. Thank you both. That was really, really interesting. Thank you so much. So yeah, if you do have any questions, please pop them in the Q&A box or the chat and we will pick up on those now. So I'm just starting to see a couple come through. How do you measure a good employee experience?
That's a very hard question. The ways we've started to look at measure, like I said, the first way we did it was basically through surveying, because then we could kind of understand the kind of really statistical benchmark, I guess, against what was going on. So we measured, like I said, we measured satisfaction, but we also looked at specific tasks and tried to understand like how difficult is that task. That allowed us actually to prioritize which tasks to kind of start with, which was, what are the worst offending tasks? For example, is finding information really hard? Is doing learning really hard? And we kind of did it that way. I mean, the other way, I guess, to sort of look at it is do you have the right, I guess, analytics kind of set up? So I think with the company working with at the moment, they have a help desk that doesn't have kind of a call management system. So without that, without actually having that call management system, you're unable to kind of tell, like, sort of take a step back and say how many people have rung up about this topic and how long did it take to resolve and things like that. So I guess kind of looking across the piece of go, do we have the right things set up in the first place, which often people don't. And the other way, I mean, we've kind of looked at it is to kind of go like, what is it that we want to do? So for example, we want employees to be really happy with something. And then we kind of go, okay, how will we measure how happy they are right now? And then how can we measure that again at a later date? Like I said, some of it is surveying. I mean, surveying is probably one of the easiest sort of ways to sort of understand sort of sentiment. But then we kind of then redo it when we kind of go and we actually sit with them, if we do a usability test, we'll ask them a sort of similar question, obviously like on a smaller scale with 10 people, but then it sort of says, have we actually moved the goalposts and stuff? And yeah, when you've got good analytics in place, you can actually start to say like, okay, on our intranet, what are people looking at? On our, across our systems and services, what are people using when and how are they using it? And I think that really gives you a good indication of like what is going on in the experience as well. But it's a rich tapestry. It's really difficult. And I think the three measures actually I keep coming back to, which I've heard used quite a lot, I think are efficiency, satisfaction, and I can never remember the last one, effectiveness. So if you're measuring those three, and that's what we've been trying to do. So how satisfied are people with the system? How easy is it to use? So that's often like time, and how effective can they use it? Does it actually work? And those are the sort of measures that we kind of keep coming back to. Yeah, so it's a really long answer to that difficult question.
Great, thank you. Sophie, would you add anything to that?
No, I think Hannah gave a really comprehensive answer. Often there are also existing staff surveys that you can tap into, which can be quite useful. And I think, you don't need to reinvent the wheel, and often just measuring something rather than getting all hung up about what's the perfect ideal metric to do here. Even basic things like time on task, things like that can be really helpful in making a case.
Great, thank you. So Matt has asked, specifically to you, Sophie, how did you approach the need to rapidly scale the research and design ops team?
So in terms of starting off, I think hiring, so we brought in, partly through my own network, someone with existing experience setting up design in research ops. And we had some really good experienced people like Salman Patel, Jess Lewis, coming through the team. I think what's really beneficial about that is they already had all the knowledge of what do user researchers need and what do they need to set up. And we learned quite heavily on the 8 pillars of user research framework, which Emma Bolton and the research ops community had come up with, which just gave us a really good starting point to say, okay, what are the things we need to worry about? And a bit like Hannah was just touching on, which of those do we need to look at most urgently and originally for the team? So I think there was that sort of knowledge of what user researchers need and what needs to be set up, so they could they didn't need to spend 6 months finding that out. They could hit the ground running with just getting going on the right. We know we need these things. How are we going to get them in place? Then the second hire was a talent manager. So someone to really focus on recruitment and onboarding, getting all our job descriptions right, which when you're obviously trying to scale a team really rapidly, one of our most critical barriers was just literally getting the people in the door. That won't necessarily be, you know, what everybody needs to worry about. So other teams might want to start more with sort of tooling. We also didn't have to worry so much about a design system, which is often a place that design ops starts, because we had the government and NHS design systems already in place. But I think in terms of that sort of getting started, hiring in a couple of experts, I think that's easier with research ops. We really struggled to find a design ops person to start with. I think it's a less mature discipline, and it's more perhaps disparate in terms of what it can cover. And I know other organizations, like say Spotify, they talk about more like design management, which, so, you know, you might want to play around with different ways of framing what the job is. And then you can bring more generalists in, you know, underneath. Not everybody on the team needs to have that expert knowledge, but they need that expertise on tap. So you can then, in terms of perhaps more sort of junior members of the team, and that's how we sort of built it up. So we had the lead, who was quite senior, but then when we were able to bring in other people, either sort of generalist civil servants or some of the more junior researchers and design management people to help support them.
Great, thank you. And I think a nice follow-up to that was that Amanda's asked, are you looking for a particular skill or capability in those early or first hires, especially in research ops?
I think experience having done it before, which obviously not everybody will have, but I think that is really helpful. I think a tolerance for bureaucracy is very important if you're in a large organization, because and quite a pragmatic attitude to that. The perfect is absolutely the enemy of done and better when it comes to improving the experience for your research ops team. I think that's quite a tricky mindset to hold sometimes, to say this would be better and this is the thing we ultimately want, but we will make do with this thing if we can get it to do this, this and this, and being quite clever with how you can sort of work around some of the constraints there.
Great, thank you. And I think we'll take our last question now, because we're running a bit short on time, and it's quite a biggie. Can either of you give an example of when you've seen a direct link between the great employee experience impacting a great customer experience?
I actually have a couple here. I mean, one of them is Octopus Energy, and they're rated one of the highest. We looked at their customer centricity, and they rated as one of the highest companies that we looked at. And in the last year, they've seen a revenue growth of 195%. And their ethos is kind of based on offering amazing customer service. The other kind of example I found was ServiceNow. I think ServiceNow is a B2B software provider. And it was rated the best place 2022 to work by Glassdoor. But it's also rated 4.3 on Gartner for customer experience. So that's another really good example of where those two things kind of you can see them sort of matching up. And it's interesting, actually, Glassdoor's best places to work in the UK 2022 features no less than 19 technology companies. I think it's a list of 50, but I think that's quite a big proportion, because I think we started to see technology companies definitely leading the way in terms of how you're working, not just like in terms of how you provide a good like external customer experience, but how you're providing what you're providing for your employees. And I see that across. That's why I kind of like working in kind of where I work, because there's definitely a much bigger focus on what's the employee experience like, and do you have the tools to do your job, and that sort of thing. So yeah, those are the examples I've got. Don't know if you've got any, Sophie.
I think there's probably a couple from healthcare. I think one significant one from our work on Test and Trace was actually where we had a team who people I remember, was it last summer or the summer before? Time is a strange beast in the world of the pandemic. When we rolled out lateral flow testing, the rapid tests that you do yourself at home, and one really key way that people could access that was through their employer, through their workplace. And we had a team dedicated to the user experience of workplace testing, and the area that they came to focus on was actually the onboarding experience for the employer, and for those, so that sort of B2B customer experience, if you like, because a lot of small employers just simply weren't getting through it. They estimated it would take 40 hours to read all the documentation you needed to set up a testing site, which is potentially works if you're a massive employer like John Lewis or someone like that, but for a lot of the smaller businesses and factories who didn't have, you know, a dedicated person who could do that, so they did a massive amount of work to strip back all the documentation to make it really accessible and user-friendly, and that had a significant impact on the number of employers and workplaces who were able to introduce workplace testing for their employees. So I think that's a good example. I think there are some fantastic examples in the NHS. It's I talk quite a bit about how it negatively impacts on patient experience, but a good example might be, for instance, the work that Moorfields Eye Hospital did around their referrals systems. And by introducing digital technology, what they were able to do is, rather than someone with an eye problem needing to travel to Moorfields Hospital, there are only about 2 or 3 of these really specialist eye hospitals in the country. So if you're in Newcastle, you might have to travel quite a long way to get it. By using digital technology, they were able to set it up so that you could visit a local optometrist who would have the kit to scan your eyes, and then they could transmit what are really high resolution, big images to Moorfields, do a virtual consultation. So you are getting the patient gets the benefit of the expertise in Moorfields with the convenience of being able to essentially go to their local high street to actually have the scans done. But that's only enabled by giving the staff those tools and those digital tools that enable them to communicate virtually and remotely while doing that.
Brilliant. That's lovely. Thank you so much, both. Sorry to anybody that we didn't get to your question. Please, if you want them answered, just send them through to marketing@cxpartners.co.uk and we will ask Hannah and Sophie to answer them offline. If you're not already, please do sign up for next week's session on people and communications. That's our last session of Customer Centricity Month 2022. But thank you so much for joining us today. Thanks everybody, and thanks Hannah and Sophie.